So my name is Jessica, but I usually go by Jessie. I use the pronouns she and her. My program is the Bachelor of Arts in Health and Community Services with the Indigenous Peoples Health focus. My practicum in education took place on the traditional territories of the Songhees, Esquimalt, and Wasanic nations, on whose land I am able to work, study, and play. I hold many places of privilege. I'm a white second-generation Canadian settler of Scottish and Polish descent. I speak English and some French. I have a quality education, and I am cisgender. My practicum took place with the community-based health equity research at the University of Victoria. SHARE is an interdisciplinary collective practicing community-based health research. Specifically, I worked within the Youth Experiences Project, conducting a literature review and contributing to 2 items for publication. The Youth Experiences Project was a mixed method study with quantitative surveys with 449 youth, qualitative interviews with 38 youth, and qualitative interviews with 8 police officers. 5 significant recommendations came from the experiences of youth who use drugs and their interactions with police. These recommendations were brought to 8 police officers from the same regions as the youth. I contributed to the results section of a paper for publication and to a 4-page insert as an addition to the original youth recommendations report. The 3 learning goals for my practicum were the development of research skills through workshops, practice, and a literature review, development of a professional level of work performance, and improving interpersonal skills. For the lit review, I scanned for information that aligned with the recommendations from youth on police communication, drug policy changes, training, accountability, and the benefits of community policing. The literature review was based on law enforcement interactions with people who use drugs and was youth-focused while incorporating a feminist and Indigenous lens. I was able to integrate my knowledge of the social determinants of health into my work while conducting research and creating evidence-based materials for knowledge translation and exchange. In addition, looking at literature from a decolonizing lens fits in with my area of focus, Indigenous peoples' health. Knowledge translation and exchange outputs include a 4-page report as an insert to the current report in print and online, and sharing results and talking to Caitlin Shane from Pivot Legal in Vancouver. The practicum experience allowed me to hone my research skills and learn about tools commonly used in the research process. What was most meaningful during the practicum was diving into the recommendations made by youth and the police responses. I was happy to see that police officers and leaders are aware of the issues that contribute to the overrepresentation of people who use drugs in the criminal justice system. The concepts learned through my practicum are relevant to my future work, as I plan to work with youth who use drugs and would eventually like to go to law school. I selected call to action number 38, which states, "We call upon the federal, provincial, territorial, and Aboriginal governments to commit to eliminating the overrepresentation of Aboriginal youth in custody over the next decade. Working towards better interactions and outcomes between youth who use drugs and law enforcement through evidence-based practices should reduce Aboriginal youth in custody. As a graduate of the BA in Health and Community Services program, I will operationalize call to action number 38 by continuing to engage in my work through a lens of decolonization." The value that most aligned with my practicum is community-based approaches to research and knowledge development. Through this work, I participated in community-based health equity research and knowledge development and exchange. The project is based on social justice and equity for BC's community of youth who use drugs. It is hoped that police will have more respectful and supportive interactions with these youth. Finally, this work gave opportunities to share the experiences and opinions of youth who use drugs and their responses from police. There is a hope that what we have done has provided opportunities for police to reflect on how they interact with youth who use drugs and to continue to push for changes in policy and police culture that will better serve youth who use drugs. Out of my practical skills of focus, cultural safety and competence stand out the most to me. Cultural safety and competence are an integral part of the research and knowledge translation and exchange that I have been working on. One of my tasks in synthesizing information related to the two sides of the study was to approach my literature review from a decolonizing Indigenous and feminist lens. The most meaningful things that I learned during the practicum was how much work goes into research. The most meaningful things that I learned during the program were from my focus on Indigenous people's health, cultural safety, and the social determinants of health. Areas that I need and want to develop are interpersonal competency and confidence while presenting ideas to others. I will continue to develop these skills by networking and participating in Toastmasters. Thank you to my practicum supervisor, Dr. Marian Selfridge, for her guidance and instruction during my practicum, and to everyone at SHARE, all of my professors and classmates who I've worked with over the past 2 years, and especially Heather and Jaime for their support. This program gave me the skills and knowledge necessary to have a successful program and future career. The practicum experience reinforced my interest in my community of choice, youth who use drugs, and the criminal justice issues that affect them. Going forward, I will continue to apply the concepts of social justice and decolonization to my vocational and educational goals. Thank you. Then I have my references there.